Hello, everyone, and welcome back to another episode of FitChat. I am your host, Jenny Turner, and this month is all about heart health. It's February, so we're going to talk about being heart smart, be well today, and thrive tomorrow. Okay. Now, just note this information is for educational purposes only and should not be intended to provide medical advice. You should always, always, always talk with your doctor for advice about any changes that might affect your health. So just note that. Our agenda today, we're going to have an overview of the biometrics and the numbers that you need to be looking out for that matter. And then we're going to create a heart healthy lifestyle, which includes nutrition, movement, sleep, being tobacco free. And then we're going to talk about the signs of a heart attack, which are so, so important. And then we'll summarize everything we covered today and talk about next steps. So first, what is heart disease? Heart disease is a general term that includes many different types of heart problems. So the most common type is coronary artery disease, or CAD. This develops over time when a sticky substance called plaque builds up in the arteries. Now, this plaque can eventually narrow those vessels and block flow to the heart. This can lead to angina, which is chest pain, a heart attack, heart failure, the heart can't pump enough to get blood to the body, or arrhythmias, which affect the heart rate or the rhythm of the heart. Now, some risk factors can't be controlled, such as age, unfortunately, and family history. However, many are lifestyle related things that can be changed. High blood pressure, high cholesterol, tobacco use, diabetes, obesity, poor diet, physical inactivity, and alcohol use. So these things are what we're going to be focusing on today. Now, heart disease causes about 1 in 5 deaths in the United States. So extremely important that we're talking about this. So let's test your knowledge here. I've got a question for you. See if you can answer it correctly. Cardiovascular disease is the leading cause of death for men. Where does it rank as a cause of death for women? A is number 1, B is number 2, C is number 3, and D is number 4. So where do you think it ranks as cause of death for women? If you guessed A, you are correct. It is the leading cause of death for men and Americans overall, but people don't realize that it's also the leading cause of death for women. In fact, it causes 1 in 3 deaths in women each year. So again, extremely important that we talk about all of this. So let's begin with a discussion of the common biometric measures that are used to assess heart health and your risks. So there are 4 key biometrics that matter for heart disease risk. You've got blood pressure, you've got cholesterol levels, also called lipids, blood glucose, and your weight or body mass index, also called BMI. Now, blood pressure measures pressure in the blood vessels. The systolic, which is the top number, is when the heart is contracting, and the diastolic, which is the bottom number, is when the heart is relaxing between beats. So, a normal blood pressure is less than 120 over less than 80. If your blood pressure falls in 2 different categories, the higher number determines which one applies. So for example, a blood pressure of 132 over 76 would be considered stage 1 hypertension. A systolic blood pressure higher than 180 or a diastolic blood pressure higher than 120 is a hypertensive crisis. This is an emergency and a risk for a stroke. So you should seek care immediately if you see those numbers. Only your healthcare provider can diagnose high blood pressure, and they can help you determine your individual goal. Okay. But truly use this chart. It's very helpful when you're looking at your blood pressure numbers. Blood lipids are often measured together, typically when fasting, so nothing to eat or drink besides water for at least 8 hours. Now, key values to know here, your LDL cholesterol is also known as bad cholesterol. Higher levels increase the risk for heart attack and stroke, so the lower that number is, the better. Less than 100 milligrams is a common goal, although people with a history of heart problems may have lower goals. Now, HDL cholesterol is also known as good cholesterol because it may help protect against heart attack and stroke. Now, optimal levels for HDL are at least 40 milligrams for men and at least 50 for women. Now, triglycerides are the most common type of fat in the body. It's best to aim for less than 150 here. Total cholesterol, while it's not on this slide, is also part of the lipid profile and commonly used as a screening tool. So less than 150 is where is considered optimal for total triglycerides. Now, your individual goals may vary. So again, talk with your healthcare provider to know what your goals should be with lipids. So blood glucose, blood sugar is another important measure. Having diabetes is a major risk for heart cardiovascular disease, and keeping blood glucose levels in good control reduces your risk. So ask your healthcare provider about screening and what is recommended for you, but screening is the best way to detect diabetes or prediabetes, which is when glucose levels are high and you may be able to take steps to reduce your risk of eventually developing type 2 diabetes. There are three different tests that can be used to screen for diabetes. You've got A1C measures. A1C, which measures average glucose in the blood over the past 2 to 3 months. Less than a 5.7% is considered normal. Then you've got fasting blood glucose, which measures glucose after at least an 8 hour fast. So you've had nothing to eat or drink except water. And then in that case, less than 100 is considered normal. And then a glucose tolerance test measures glucose 2 hours after drinking a glucose rich beverage. Less than 140 is considered normal there. So only a healthcare provider can diagnose prediabetes or diabetes. And if your results are elevated, the test is usually repeated to confirm the results, just to make sure. So overweight and obesity are risk factors for heart disease. There are several options for determining your body composition. Body mass index, also known as BMI, is determined by height and weight. There's many calculators available online that are free, but BMI has some limitations as a screening tool and can be less accurate for some people. So it's just one tool. The normal BMI range is 18.5 to 24.9, but it can also be a tool to measure changes over time. So it can be helpful when looking at those changes over time. Waist circumference is another measure to assess risk. Now, carrying more weight in the waist is linked to a higher risk of heart disease and type 2 diabetes. The ranges linked with lower risk are less than 35 inches for women and less than 40 inches for men. Body fat percentage is an additional measure that can be used to measure risk, and ranges vary by age and sex. Now, there are various ways to measure body fat, such as certain scales, BIA, and skin fold measurements. So talk with your healthcare provider about your individual risks. Now, that we've talked about assessing the risk for heart disease, let's talk about how you can take action to promote a heart healthy lifestyle. There are a lot you can do to risk for heart disease through a healthy lifestyle. So many of the lifestyle choices that support heart health also help reduce the risk of other chronic health problems like type 2 diabetes, strokes, etc. And overall just improve your well-being. So your healthcare provider can help you look at your individual situation to review your overall risks. Nutrition is a key part of heart health. The overall pattern of eating matters much more than a single food choice. A heart healthy eating pattern is one that is rich in fruits, vegetables, whole grains, lean protein, low fat, dairy, and healthy fats. It's low in saturated fat, added sugar, sodium, and alcohol. Now, nutritious food choices support healthy blood pressure, cholesterol, weight, heart, and brain health. So, choosing more meals prepared at home makes it easier to include more nutritious options in your eating pattern because you have greater control over your food choices and how those food choices are prepared. So, highly recommend eating at home more versus eating out. It's important to understand the differences in the types of fat in foods because they affect heart health differently. Now, unsaturated fats are known as healthy fats and they're linked to heart health. Saturated fats are solid at room temperature, and those may raise cholesterol and increase your risk for heart disease. So choose healthy fats in place of saturated fats. Um, you want to try to choose unsaturated fats more often. These include healthy oils such as canola, olive, avocado, and peanut oil. Avocados are a great choice. Nuts and seeds, nut butters, peanut butter, almond butter, olives, and fatty fish such as salmon, tuna, and herring. Choose saturated fats less often and replace those with unsaturated fats. So try to replace your butter, your lard, your fatty meats like bacon, sausage, hot dogs, even poultry skin, be mindful of that. And then tropical oils. So coconut oil, palm, and kernel oil. Now, most Americans eat too much sodium. So the recommendation is to eat less than 2,300 milligrams per day. On average, Americans eat nearly 3,500 milligrams per day. The salt shaker is not the main source of sodium. So instead, more than 70% of sodium comes from packaged, prepared, and restaurant foods. So there are many ways to eat less sodium. Read labels carefully on packaged foods and condiments. Okay. They had a lot of sodium. You want to choose fresh vegetable over canned, frozen, choose fresh vegetables or canned or frozen vegetables with no added salt or sauces. A lot of times your frozen vegetables include sauces in there, so just be mindful of those additives. You want to limit fast and restaurant foods, which are higher in sodium. So check the websites for nutrition facts. And then limit or avoid processed meats, such as deli meats, hot dogs, bacon, and sausage. And then try to choose other ingredients to flavor foods instead of salt. So citrus, vinegar, herbs, spices, garlic, onion. Try to use those instead of just throwing salt on your food. Maybe you've heard that a glass of red wine is good for your heart. And it's true that red wine may have some flavonoids and other phytochemicals that are linked to a lower risk of heart disease, but there's no research providing a cause effect link between drinking alcohol and heart health. Those same flavonoids can also come from things like grapes and blueberries. So, drinking alcohol can increase a variety of health risks, including high blood pressure, heart disease, stroke, and some types of cancer. And drinking large amounts of alcohol is linked to even more risks. So, alcohol also has calories, which can add up quickly, especially in drinks with sugary mixers. So, what is recommended for alcohol and health? First, if you don't drink, don't start. No health guidelines recommend drinking for heart health. If you do choose to drink, it's best to do it in moderation. Now, moderation means no more than one drink per day for women and no more than two drinks per day for men. And it's also important to know what counts as a standard drink: 12 ounces of beer, 5 ounces of wine, 1.5 ounces of 80 proof liquor, or 8 to 10 ounces of hard seltzer. It's important to know that there is no amount of alcohol that is completely safe. If you choose to drink, drinking less is better than drinking more. Being physically active has countless benefits for heart health and overall health. Now, these include supporting a healthy blood pressure, cholesterol, weight, and blood flow, which is extremely important, helps prevent bone loss. It keeps you fit and able to do daily activities. It boosts your mood and helps manage stress. And it helps you sleep better and so much more. So, there's so many benefits of movement. So there are different types of physical activity, and all of them are important, and each plays a different role in supporting your overall health. Here are the recommendations for each. So you've got cardio. You want to aim for at least 150 minutes per week of moderate to moderate intensity activity, or at least 75 minutes per week of vigorous intensity activity. So spread your activity out across the days of the week. Then you've got strength training. You want to aim for at least 2 days per week. You want to include exercises that work all of the major muscle groups, so upper body, lower body, and core. And there are countless options for strength, including dumbbells, weight machines, and body weight exercises like push ups or squats or planks. Flexibility. You want to include stretching and flexibility and mobility exercises, ideally most days of the week. You want to sit less, so aim to get up and move throughout the day. There is a link between prolonged sitting and chronic disease, so taking breaks from long periods of sitting is important in addition to a fitness program. Now, we know we sit at our desks a lot, so getting up and taking breaks is extremely important. Safety first. Check with your doctor before starting with exercise, especially if you have any heart or health conditions in general. Always warm up before exercising and always cool down afterwards with a period of lower intensity activity. So important to stay safe. Next up is sleep. Sleep is also an important part of heart health and overall well being. Poor sleep increases the risk of heart disease, high blood pressure, high cholesterol, high blood glucose, and obesity. So adults need an average of about 7 to 9 hours of sleep per night. You want to choose good sleep hygiene practices to help you sleep well. Stick to a regular sleep schedule. Be physically active during the day. Create a cool and comfortable and quiet sleep environment. And then create a relaxing bedtime routine. Bedtime routines are not only important for children, but extremely important for us as adults as well. Kind of gets us in the mood for sleep. So let's wrap up this section by talking about tobacco use. Smoking harms nearly every organ in the body, including the heart and the blood vessels. Now, this damage makes it easier for that plaque to build up in the arteries. It raises the risk even more if you have other risk factors such as high blood pressure. And secondhand smoke is also a risk factor that can damage the heart and the blood vessels even for people who don't smoke. So if you use tobacco and you want to quit, resources are available. First, talk with your healthcare provider as always, and also check into options through your employer and your health plan. You may have access to resources and even medications that can greatly increase your odds of quitting for good. So to learn more, you can always visit smokefree.gov. That's a great website and resource for you if you're looking to quit smoking. So it's really important to be aware of the signs of a heart attack so that you can react quickly, and every minute matters to save a life, yours or even someone else's. So heart attack warning signs. Chest pain is the most common symptom of a heart attack. It may last a while or go away and return. It can feel like uncomfortable pressure. It can feel like squeezing. It can feel like fullness or pain. Other symptoms include pain or pressure in the lower chest or upper abdomen, lightheadedness, nausea or vomiting, jaw, neck, or back pain, pain or discomfort in an arm or a shoulder, shortness of breath, fainting, breaking out in a cold sweat, or extreme fatigue. So, if you or someone near you experiences any of these symptoms, it's important to call 911 immediately. Again, every second counts. So, men and women often have different symptoms of a heart attack. For men, chest pain or angina is the most common symptom. It may feel like pressure, squeezing, or fullness in the center of the chest. And for women, chest pain is still the most common symptom. However, women are more likely to have other symptoms like back or jaw pain, shortness of breath, nausea, vomiting, or extreme fatigue. So do not delay seeking care when experiencing any of these symptoms. Again, every minute matters. So calling 911 can help you get life-saving treatment faster. So let's wrap up with a final summary. So heart disease is the leading killer of both men and women in the United States. Lifestyle steps can help reduce your risk. Now, remember to talk with your healthcare provider about screening tests, how often, and your personal goals for your numbers. Know the signs of a heart attack and act immediately. What is one small step you'll try in the next week? Examples could include adding a short walk after lunch or dinner. You could choose an additional serving of fruits or vegetables. You could make an appointment with your provider to discuss your risk factors. You could read more about heart attack symptoms and when to take action. You could also join in March. We have our Nutrition Simplified webinar series along with our Healthy Eats Challenge. So that's a great way to focus on nutrition next month. So make sure you're registering for that. We also have access to fitness guidance and coaching. So if you're looking to be more physically active, whether that means going for more walks or introducing strength training into your routine to meet those guidelines for cardio and strength training. Meet with one of our fitness professionals. We're here to help you. We can give you a free workout plan depending on your goals. And we can coach and guide you through accountability appointments to make sure that you're sticking to those goals. And we can always rework those goals and try something new if it's not working. So if you need help with nutrition or fitness, we are here to help. But again, always talk with your healthcare provider about specific numbers, blood pressure, lipid levels, all of those things. So we're here to help. Reach out to us or myself at any time and keep your heart healthy this month. So if you have any questions in general about this Fit Chat or anything else, please reach out to me. But that is our February Fit Chat. Thank you so much for listening, and I will see you next month.